Okay, thank you everyone for joining today, and welcome to the next in our lecture series from St. Luke's and the Idaho Clinicians for Climate and Health on climate change and how it impacts human health. Today we have two speakers that are going to speak to us about the climate impacts of heat and how heat is in turn affecting human health globally in Phoenix, Arizona, and here in Boise, Idaho. I do want to set up our fall lecture series as this is our last lecture for the spring. We have an outstanding lineup for the fall starting in August with a talk on wildfire smoke from Dr. Moji Sadegh from Boise State University and Dr. Alex Rabin, a pulmonologist from the University of Michigan. And those will be followed by talks on plastics and their impact on health, a talk on some innovative building design at the Ohio State University's Healthcare Center and what you can do in your own home to be more innovative and more climate friendly. And ultimately, we'll wrap the fall series with a talk from one of my climate heroes, Bill McKibben. So first, I'm going to introduce Dr. Geoff Comp, who is currently an Associate Program Director for the Creighton University School of Medicine Emergency Medicine Residency at Valleywise Health Medical Center in Phoenix, Arizona, formerly known as Maricopa. Geoff participates as a leader, mentor, and advocate for wilderness medicine and EM medical education with experience lecturing and teaching locally, regionally, and nationally. His professional and research focus includes wilderness medicine, physician wellness, mentorship, as well as innovation and medical education. He constantly seeks opportunities to combine his interest through collaboration with others and outdoor exploration. Outside of medicine, Geoff can be found running or road biking and trying to find the best Mexican food in Arizona, or chasing his 3-year-old twin boys, Austin and Carter, with his wife, Mackenzie. Thanks so much for joining us today, Geoff. I hope to come down there and find some of that good Mexican with you, not too distant future.
Oh, absolutely. Yes, please. Anyone's welcome to come on down. We've got incredible food and the kind of hot sauce that will just peel the enamel off your teeth. It was a really such a nice introduction. Thank you so much. Give me one quick moment and I'll get my slides all set up for everyone. Okay, are you seeing just my images, guys? Perfect. Okay, so a super incredible, nice introduction. Thank you so much. My name is Geoff. I'm one of the APDs down here in Phoenix, Arizona, as well as academic and community emergency medicine practicing physician. So I wanted to, and I was invited here to talk a little bit about what we unfortunately are pretty good at in Arizona, which is heat-related issues and climate change and experience. So apologies. So what we're going to start off by going through is a little bit of a background on just climate in general, right? So we're going to talk about how some of these factors can impact our overall health, a little bit of the spectrum of heat illness with a huge focus on heat stroke, and then finally, evaluation and treatment of heat illness with a focus on something that we're a little bit more innovative at our sort of, I guess, immersive cooling protocol that we used down at Valleywise in Phoenix. So, so this is us. Heat stroke and other heat-related emergencies are, increasingly becoming a significant public health risk, and this growing impact is evidenced in the global climate change with record-breaking temperatures, increasing frequency and severity of heat waves, and global extreme heat events becoming just increasingly more common all the time. According to the National Oceanographic and Atmospheric Administration, recent years have just ranked among the hottest in recorded history. So here in Phoenix, like I started off by saying, we're unfortunately really good at heat illness. July 2023 was the hottest month ever recorded globally. Here in Phoenix, we had 33 days with temperatures greater than 110. The previous record of 18 was set in 1974. And within this month, we had an average of 102.7 degrees Fahrenheit and a maximum of 119. So we were fairly like sub-apocalyptically hot last July. Now, let's add this to your guys' experience. Average, when I looked at the average of 2020 to 2023, May was 92 degrees, June 100, July 106, August 105. But here's the issue. And we're going to get to where this comes into a little bit more of a factor. Your humidity kind of like knocked our socks off. People talk about how it's a dry heat, but there's difference in how our body can change and adapt to heat. And that's why even though your temperatures may not have been as hot as ours, heat issues and illnesses are still something that you guys are going to need to be taking care of and thinking about. So for May, averages were the same amount of time frame, 45%, 42%, 34, and 33. Now for us, May, we were 19%, June, we were 17%, July, we were 29%. So much different. So that change in the temperature was hotter, obviously, for us, but a lot of the ways that our body dumps out heat and dissipates heat aren't really able to be taken advantage of up in your neck of the woods. So to set the stage, now that we've talked about the weather, heat-related deaths are one of the deadliest weather-related health outcomes in the United States. According to the US CDC, in the average year, so this is a little bit older data, 2004, 2018, 6,000, a little bit more than 6,000 or 67,500 ED visits, 9,200 hospitalized, 702 heat-related deaths. In Idaho, I was having a conversation earlier with some of the other moderators. In 2021, it recorded that there were 11 heat-related deaths in Idaho, but I haven't found any other data for additional years. And it seems like it's not something that's tracked as much, and that's something that it sounds like is in the process of trying to get improved. Now, again, that was older data. This was our last year's statistics. In Maricopa County, so this is a large county where Phoenix is located, we had 645 deaths. Our first death last year was April 11th, and we had a significant amount of cases that were still being under investigation for being associated with heat through September and October. At our shop, at our hospital, from 2014 to 2019, we had around 2 to 7 cases of severe heat illnesses per month. Last year, we had 18 per month. So as we've been seeing, unfortunately, an increase in mortality and ED visits from earlier in the century. And it kind of, we're going to move a little bit more towards how the body interacts with heat and what we can kind of do to treat it. And it kind of, core temperature boils down to how the body manages heat. And actually, I wish I could see you guys, because I made the joke about boiling down and core temperature, whatever. I'm sure everyone's laughing at home. So we think about heat production and heat accumulation and heat dissipation. This is how these all work. So if the internal production and the external application of heat outpaces the body's ability to dump it out, your core temperature rises. Now, what we do is we are actually pretty good as humans to get rid of some heat when the temperature is greater than the surface temperature of the skin. So we have some vasodilation to get some of that hotter or warmer blood out. Sweating, obviously, that's our own sort of self form of evaporative cooling, and tachycardia to increase that amount of blood that can be going out. Now, any condition that limits heat loss through the skin might lead to heat retention. So extensive scars, medical comorbidities that could prevent any sort of issues like this, extremes of age, medications, stimulants that increase internal production versus even some antipsychotics that can directly impact heat production. So there are a couple of different factors that within the body can unfortunately make things a little bit worse. Now, much like weight training, we can get better at it. So with adaptations around 1 to 2 hours of exposure over 10 to 14 days, we can find some demonstrable abilities that to increase the body's ability to tolerate and even dissipate heat. And these can persist for up to a month. It seems that people with high levels of cardiopulmonary fitness can tolerate activity heat strain conditions. And what we're kind of taught is that heat illness is more severe in those traveling to warmer climates rather than, quote, the natives, as the locals tend to have some different adaptations and have a little bit more of, to be a little bit more acclimated. But ultimately, there's only so much that you can get to. There's only so much your body can do to prevent development of heat-related illness and injury. So hyperthermia in general, just elevated temperature, a rise in body temperature when heat dissipating mechanisms are impaired or overwhelmed, resulting in injury. The first one that we kind of talk about, this is heat exhaustion. Characterize intense thirst, weakness, discomfort, maybe even some dizziness. There are other conditions. You can have some heat edema, you can have heat syncope, even heat cramps. These sort of all fall in some of these conditions all fall under this heading. The treatment for this, obviously, is removed from heat sources, cooling, trying to get them out of the heat, letting their body sort of take over and help with that cooling. Now, heat stroke, this is the true emergency, and this is the incredibly concerning condition that we're really focusing on. So this is severe heat illness characterized by environmental hyperthermia, and I think that's important, right? So this is elevated temperature as a result of the outside environment, plus central nervous system abnormalities. Usually for, I guess if we think about practical applications, like a GCS of 14 or less, and a temperature greater than 40 degrees Celsius or 104 Fahrenheit. As an asterisk, lack of sweating is not a requirement. This was something that was taught, decades ago when I was in the Boy Scouts. Heat stroke is characterized by a lack of sweating, and that's not really correct. There are different forms of heat stroke, and in some of them you may see a decrease in sweating because they're just so dehydrated, but in other forms you may have incredible amounts of sweating. So that's not one of our diagnostic criteria. So it is elevated temperature, elevated environmental temperature, plus altered mental status. The first one is exertional heat stroke. This, unfortunately, is the patient that comes in, or the person that's an athlete that's been exercising or practicing in the hot summer and then has a collapse and unfortunately might die. This is combination of the heat production, heat gained from the conditions that exceeds the ability to remove from the heat. So other ones, working in job conditions, military recruits, cadets academy, road workers, people that are working outside in the heat. That's more of our exertional heat stroke. And the classic heat stroke is the same output, but a little bit more of a longer presentation. This is kind of I have this example here, the elderly grandma who lives alone and doesn't have AC, and it's constant high environmental heat stress over a longer period of time. So these patients might have a decreased amount of sweating because they're just so dehydrated from their body trying to keep up. But it's the same diagnostic criteria. So that altered mental status and the elevated temperature. We've talked a lot about how to figure this out, but why do we actually care? The outcome mortality, morbidity is directly attributed to both the magnitude and the duration of the hyperthermia. So making this early recognition and diagnosis and treatment a huge priority. With exertional heat stroke, there's a 10% risk of death, all comers. If there's associated hypotension, that goes to 33%. So a patient with hypotension and diagnosis of heat stroke is a very, very, very concerning patient. And it's also very concerning because for the most part, if these patients are treated and the heating that hot process is stopped, there are some usually pretty good outcomes. So, excuse me. And then I had one other thing. In classic heat stroke, 65% mortality in general. So this is, again, that patient that is sitting there with long-term exposure. So how does that happen? This is a very, I guess, superficial discussion, but you have the initial thermoregulatory dysfunction. We think at certain heat thresholds, you ultimately have apoptosis, cell death, and from there, initiation and I guess activation of heat shock proteins, arachidonic acid pathways, a lot of the different things that we all learned from biochem and immunology that ultimately results in multi-organ failure, encephalopathy, rhabdo, hepatic, renal failure, hematologic abnormalities, excessive bleeding, clotting, and ultimately tissue injury and death. So after we've identified our patients and our understanding of what the process is and how we need to treat them, we need to figure out our priorities for management, right? So first one is just removed from the environment. Supportive care, airway, breathing, circulation, as needed, right? The challenge here is going to be an elevated temperature with altered mental status. And when we think about that, there are so many things that can be on our differential. Everything from primary conditions, sepsis, endocrine abnormalities, but also including other factors, right? So we have to think about why, especially for us, why did the patient have the continued exposure to heat? Unfortunately, we think about here in Phoenix, a large percentage of our heat stroke patients tend to be undomiciled, homeless, tend to have different either toxic substances or drugs on board. But the other thing that can happen is, did someone have a heart attack? They have an MI, and that caused them to go down, which caused them to then sit and sustain further heat stroke. Same with stroke. So keeping in mind our differential is super important as we're also removing them from the environment, right? So we need to think about heat stroke, but also make sure that we're thinking about all of the other factors that could be affecting the patient right now. This is our addressing additional concerns. If we can get additional information, EMS is a super incredible, helpful partner in this. What did the situation look like? Were there people around? What was happening prior to this event? And then resuscitation, supportive care, and cooling. This is pretty variable. And there are a couple of thoughts. There's passive versus active cooling. With passive cooling, this is just letting the body take over, trying to help someone in cooling themselves. So this is assisting someone to shade, loosening the tight clothing, increasing some sort of air circulation, assisting with hydration. Active cooling is when we do something to someone else. So this is evaporative cooling, where we're spritzing someone with water, we're putting a fan on them, trying to increase that evaporative cooling component of it. Chemical cold packs, so putting classically the neck, the axial groin, places where we feel like there's going to be more superficial blood flow to try to increase that heat transfer. And then IV, like cold IV fluids, which isn't great. It will. So a cold IV fluid will decrease someone's temperature a little bit, like 2 times faster than room temperature, but just that in itself is not enough. There needs to be other, I guess, mechanisms that are put in place. So if you can do cold fluids, it's going to help, but it's not enough. And this is where our hospital comes in to be a little bit unique. For us, we do for all comers with heat stroke, we do a total body cold water immersion. We put people in body bags with ice water. We do continued temperature management and evaluation, and we see their temperature decrease because we know that the amount of the Tmax and the time at temperature is what causes and was a big result of mortality. So if we can drop them fast, there's a huge benefit. So when you look at some of the data, immersion takes, looks at some of the different like hydrodynamic properties, not hydrodynamic, but some of the different physical properties of liquid versus air mediums. So water's conductivity is 24 times greater than air. And if you have a really high thermal gradient, so a very cold water plus the very hot skin, this is a much greater capacity for heat transfer. And it looks like when you go into some of the literature, ice water cooling has been shown mostly, the data is mostly in pre-hospital and our sports medicine arenas. Our colleagues shows to be about twice as rapid to reduce core temperature versus spraying water over the body to enhance evaporative cooling. And the faster cooling happens with colder water. So from June 1st of last year to August 31st of last year, this is our hospital, we had 54 adult ED heat stroke encounters that were determined to meet our inclusive criteria, which is 39 degrees and altered mental status. During this time, the median temperature max was like 111 actually, and then the minimum was 87. 44 of these 54 happened in July last year. In this group, the average temperature reduction duration rate of cooling was around 3.42 degrees, 33 minutes to get to temperature, and then 0.1 Celsius per minute. From those, 61% of the patients survived, and 26 of those, 33 survived, 26 survived neurologically intact. And when you look at our rate, so around 0.1 per minute, utilizing evaporative cooling strategies ranges from, so like a fan and water ranges from around 0.01 to 0.078. So faster than if we were doing a regular, I guess, evaporative strategy. This is what we do. So I have a really quick video that we use for teaching, and this is what we do when we teach this to our whole team. Are you guys hearing audio or no?
No, Geoff, we're not.
Okay, good, perfect. So we have our kits that are already pre-made with our body bag, Foley temp probe, as well as a printout of what we're going to be able to do. For all of this, BSI scene safety, make sure that we're always protected. We didn't do a great job in this video, but we're wearing when we're doing these resuscitations, gowns, gloves, shoe covers, because it kind of gets a little bit wet and splashy. If we have the time to be able to get someone prepped, or if EMS gives us a bit of a heads up, we're able to get the body or the bag already set up. We roll them as we're doing a regular primary survey, checking their back, and then we roll them back in. I think we had one patient last year that came in via personal vehicle. So almost everyone comes in for us via EMS with heat stroke. So our strategy is we get a lot of our ice from our cafeteria. We found that we were exhausting all of our ice in the ED for like drinks and stuff pretty rapidly. So we worked with our food services nutrition to get us new ice, and replenish it. So as soon as we use one of these big old buckets, we notify them and they send us up a new one. We put a little bit of water in here to make a bit of a slurry, and then we zip them on up. As you see here on the bottom, as we're doing this, we're placing lines, we're putting them on monitors. We're doing all of that in conjunction and in parallel. And then to take them out, we're just cutting the bottom of the bag. Again, this can get very wet and very slippery. So we make sure that we're trying to do it as safely as we can. So a couple things from us. The peak temperature that we got discharged alive was 110 Fahrenheit. And that's kind of, that's an interesting number because that's usually where the top of our thermometers can go. So we're recording this as our Tmax, but we don't actually know if that was the Tmax because at some point it just says high. 106.9 is kind of thought to be the upper limit of tolerable temperatures before irreversible tissue and cellular damage occurs. This was not a person that kind of walked out, but this was someone that we were able to actually save. They did have an oxygen injury and it was dependent on vent. This second patient, peak temperature discharged alive, neurologically normal, was 108.5. This is a healthy male in his 20s with an unknown downtime. And something else that we were finding in our data and results, unlike the classic exertional heat stroke or classic heat stroke, sort of like these binary two, a lot of our patients were kind of young, male, had evidence of polysubstance abuse, not really involved in work with high heat stress. So it was a bit of this mixed picture of an exertional plus classic, which is really kind of, I think, what we're going to be seeing across the board. So as we kind of wrap up, it's incredibly important, one, to understand the impact and the importance of understanding how climate change is going to start increasing the number of patients that we're seeing related to heat issues. We need to be prepared, and we also need to be thinking about how to identify these patients and thinking about strategies to effectively treat and manage some of these conditions. Thank you so much.
Thank you, Geoff. That was great. We are going to turn things over to Alex Brooks from the City of Boise next. And then at the end of Alex's presentation, we'll have an opportunity for everyone to ask questions. So please submit your questions to us through the chat or the Q&A, and we will collect all those questions and bring them to our speakers after Alex is done with her talk. So next up is Alex Brooks, the Climate Action and Sustainability Coordinator for the City of Boise. Alex's work focuses on community resilience in the face of climate change, including food systems, natural environments, and community engagement. Her background is in education and environmental science, and her goal is to make climate action approachable, engaging, and achievable. Thank you for joining us today, Alex. Take it away.
Thanks for having me. Can you see my screen okay?
Yes, indeed.
Okay. So if you live in Boise, you've probably seen this sign up on City Hall. Our climate action division with the city has a carbon neutrality goal of 2050. But unlike most of the members of my team that are working on greenhouse gas emission reductions, I focus on climate resilience. And a piece of that is extreme heat. So recently, we conducted a climate risk report to identify what risks in the future is Boise going to deal with the most when it comes to climate change. And number one on that risk list was extreme heat, along with wildfire, drought, heavy precipitation, and flooding. So I'm going to be sharing a few programs that we are already doing to mitigate extreme heat first. The first, in 2019, we conducted the Treasure Valley Urban Heat Watch, which involved community members in collecting heat data. So you can see in this picture on the left, this is a heat sensor that's connected to a car. So volunteers passively collected heat data as they drove around the city. And this was done on the hottest day in 2019, which was in July. And the result were maps that look like the one on the right. And so you can see this is from that day in July. It's 3 to 4 p.m. And the coolest temperatures are in blue, hottest temperatures in red. And the range was 85 degrees Fahrenheit to 96 degrees Fahrenheit. And we use maps like this to help drive decision making. So which neighborhoods are at the highest risk of extreme heat? Where do we need to put our resources? And because this study was 5 years ago, we are looking to update this data within the next couple of years. Another program that we work on is the Elaine Clegg City of Trees Challenge. We have a goal to plant 100,000 urban trees by 2030, and to date, almost 17,000 trees have been planted in Boise. This is a partnership with the Treasure Valley Canopy Network and the Nature Conservancy. The goals in 2024 are to create an updated tree canopy assessment. This will show our progress or changes in development over the last few years. They will also be growing their Tree Captains program, which is a volunteer program where volunteers can work with their neighbors or in their communities to identify homes or areas that would benefit from having a tree planted. And through the City of Trees Challenge, community members are able to receive trees for free. So it's a great program to be involved with, and you can learn more on their website. And looking into the future, this program will be more focused on equity-based planting and maintenance. We are finding that making sure a tree survives more than a few years and maintains in a healthy status is almost as important as the tree actually going in the ground. Last year, Our Path Home, which is a partnership of over 50 agencies, and they provide homelessness prevention services, and they provided a seasonal cooling locations map. And this winter, they provided a more comprehensive heating center resources page And so we're hoping to do the same this summer, identifying more spaces that are available for those experiencing houselessness and other resources such as showers or internet or food pantries. The challenges we're finding are areas that are available for these members of the public to access during the daytime. We also have a partnership with LADA Community Action Partnership. They provide services for low-income households, including utility assistance, food pantries, and more. But the program that we help support is the Weatherization Assistance Program. And this offers weatherizations of income-eligible families' households that could be, adding insulation, more secure windows, and those actions greatly reduce the heating and cooling costs and improve the safety of their homes. And I included a couple other photos of Boise urban planning that has extreme heat in mind. And so the picture on the left is 8th Street, which is now designated as a pedestrian-only corridor. And you can see that it is lined with trees. And those trees are offering their ecosystem services to the patrons dining down below. And then they're also offering shade to help the buildings keep their cooling costs low. On the right is a photo of Cherie Buckner Webb Park, which is located in the heart of downtown Boise. Previously, this was a location of a parking lot and replaced with this beautiful park and beautiful statue to show the benefits of green spaces and cooling in downtown urban areas. And the bottom photo is a picture of the newly renovated Molinar Park, which is on Maple Grove and Victory in Boise. And when Parks and Rec was discussing revamping this park, they had the foresight to put in an impressive splash pad and these great shade structures. And Parks and Rec is doing this in a lot of their facilities with just the thought ahead to say, how are we going to combat these hot summers? The last program that I will talk about is our Youth Climate Action Council, which is a group of 12 high school students that meet throughout the school year. We meet every other week with them to talk about and work on climate issues that they are seeing in their community. And this year, they focused it on extreme heat as their theme. And the culminating event is next week on May 15th, 5 to 7 at Whittier Community Center. We're holding a Beat the Heat block party where we'll be partnering with community organizations to offer members of the community financial aid, information about utility assistance, how to prevent heat illness, and more. I know that Full Circle Health Partners will be there along with the Sierra Club and Ada Soil and Water Conservation District. This event is free and it's open to the public. There'll be prizes and music and food and beverages. We will also be accepting donations to build heat prevention packs that we will be donating to a local shelter to hand out to those experiencing houselessness this summer. And so we're looking for donations of items like sunscreen, baby wipes, deodorant, summer clothing, electrolytes, that. So we hope that you join us for that event. And then looking forward, we're wanting to continue this work and build our efforts. And so right now we are working on a climate resilience plan. And the areas that we are focusing on are urban ecosystem restoration and community engagement. And extreme heat is going to play into both of those areas. We also look to learn from other cities in the United States that have a similar size to Boise and a similar ecosystem. And we're seeing other cities in the United States developing programs like resilience hubs, which are like beefed up heating and cooling centers that might also have solar panels and battery storage in case of an outage. But in times of non-emergency, these resilience hubs are also acting as community centers. We're seeing a lot of other cities do cool pavement pilots in their downtown areas. So this would look like picking a block in an urban area, applying some sort of pavement seal, and then taking temperature readings and seeing what kind of impact that can have on the community. We're looking at green infrastructure and built infrastructure, so things like green roofs, shade structures, water stations, and what are our options with installing those types of infrastructure in our downtown and urban areas. So if you're interested in learning more about what the City of Boise is doing with climate work, you're welcome to reach out to me, and I would love to talk more, and I'm excited to work more with our health partners going forward.
Thank you so much, Alex. Great talk and great to hear all the good work that the City of Boise is doing. Geoff, I guess I have a question that would bring you into this sort of city planning mitigation conversation. Are you aware of things the City of Phoenix is doing in the face of, a further, you guys are kind of further down the climate path than we are in terms of how hot it's gotten there, but, we're getting hotter and hotter every summer. And unfortunately catching up to Phoenix with some of our temperatures sometime, and especially when you include that wet bulb temperature like you brought up earlier. So what are some things that the City of Phoenix has done that you're aware of that we can learn from here in Boise?
It's a great question. A lot of it is in identifying different heat respite centers. So just, like Alex was saying, where are places that people can go to get to be able to cool off, and identifying and understanding where those are. And then the big key that we've been seeing is how do we connect that to the patients that are mostly at risk. Something that I didn't talk about is what happens when we discharge a patient, right? So not everyone that has a heat-related issue gets admitted to the hospital. And if they come in at 1 o'clock in the afternoon and I'm treating them for a heat-related issue and I'm just discharging them back into the heat, that's pretty unhelpful. So what we've been working on, and our next big steps are figuring out how we can connect our patients and some of our more vulnerable patients with the city and county resources that are already there. So we talked about some heat relief shelters, mobile units that are just like refrigeration cars that can kind of like be driven to places that that people might need them. There's also a water station that's kind of this grassroots, grassroots movement where people can just set up different places and say, hey, if you need to come and get some water, you can always come here. And it's everything from grocery stores, gas stations, even people's individual houses. 2 years ago, one of my residents actually set up her house as one of the places that someone can just go if they need some water. So there's the city level, but then also the community level of people that are just saying, this is a big issue, and how can we improve? There are also infrastructure components, and that's something that we're really working on as well. Without getting too far into the weeds, there was a pretty concerning news story that came out a while ago that said, hey, if there was a big power outage in Phoenix, it would be fairly deadly because of issues with heat-related problems. And they're fairly correct. So that was a big spur into, or a jumpstart into some of these different, infrastructure impacts that we can make, and what are some other next steps. I'm not as plugged in with that, but that's another change that we've been working on.
Yeah, it's really interesting and something that we have thought about. Alex mentioned the Full Circle Health will be at this event that they're putting on. And that's a group of our family medicine physicians that we partner with at the Idaho Clinicians for Climate and Health. 2 of their faculty are actually on our board, and they're doing this climate health organizing fellowship and looking at resiliency hubs as a concept for the City of Boise as part of their work. We have talked in our group a lot and thought about using neighborhood elementary schools during summer months as nodes that have they're spread out all throughout the city, because Boise Schools does a great job of having these community-based elementary schools. So there's lots of elementary schools that feed into fewer junior highs, feed into even fewer high schools, but there's just lots of these elementary schools around that people could access. I'm proud to say that, like the City of Boise, the St. Luke's Health System has now taken a climate pledge and committed ourselves to reducing our emissions by 50% by 2030 and carbon neutral status by 2050. But part of that pledge also includes working on building resiliency strategies to figure out how we're not only going to be able to operate if the power goes out, but how we're going to help the city cope with these surges of patients we might see as we have extreme heat, and see more, if we're seeing a handful of hyperthermic patients right now, what happens when we get to the 60s of hyperthermic patients? Can we handle this? Because we don't have that many ICU beds in the city of Boise. So what do we do then? Someone did ask online if we have the capacity in our ERs to do this immersive therapy. And, it's one of the beautiful things about medical training is this kind of seeding of ideas as people move from one place to another. And the way I got to know Geoff is that a couple of his trainees now work with St. Luke's and connected me to him. And one of our physicians last year did this protocol in our ER. It's not, smooth and well-oiled like it is in Phoenix, but we got a body bag from the morgue. We got a bunch of ice from the cafeteria, and they were able to rapidly cool this patient in the ER. So it is something that is the beauty of the design is its simplicity. He's using things that all hospitals have access to, not some fancy device, and making it so that it's something that we can all roll out pretty quickly. Geoff, you had a comment there about public libraries. You want to talk about that?
No, that was just even that was just in regard to different I don't want to say hotspots. That seems silly, but different areas where you can access just cooler environments. Public libraries is another one that City of Phoenix. I guess the Phoenix Public Library, Scottsdale Public Libraries, those are usually other places that can be indicated as a sort of a heat relief center within our heat relief network.
Yeah, I think, there's a stigma about some of the places that we identified that these are like homeless shelters or places for people, but heat impacts everyone. And it's not to say that people that live in a ritzy community can't go to a shelter during times of extreme heat. I think people are just less likely to use it if there's a stigma associated with it. So taking places like libraries and schools that don't have that stigma attached and are ubiquitously present, and we'd love to see them convert to solar power anyway. It'd be like a great win-win-win to see, solar with battery for emergency electricity at schools that people can access when it's too cold or too hot. Alex, any thoughts about resiliency hubs and what the city's been looking at?
Yeah, you're exactly right. What we are finding is if, you create a new building or a new resilience hub and it's not a location that's already trusted by the community, people won't utilize it. So using places like you're speaking about community centers, places that people already go, that's the most successful model that we found. When there is a heat wave or when there is another natural disaster, you need to have a space that is trusted by the community.
And also linking people to these resources. I talked about our discharge instructions. We now print off a list of all of them. So we physically hand the sheet to our patients that we're discharging saying, hey, if you find yourself in a situation where you are unable to shelter yourself from the heat, here are places that you can go to get some relief.
Alex, do you know if the city has a list like that we could share with patients?
Right now, we have our cooling and heating centers resources through our path home, but there is definitely room for improvement, and we're working to find those areas that are places that are trusted spaces that people will utilize in times of need. It's definitely on our list of things to do. Talking with people nationally, I think a lot of places on the East Coast have these established community centers that have been around for decades. And in the West, that's not such a thing. And so such a prevalent thing. And so we're trying to find sometimes, places like schools or libraries already have limited resources. And to put this resilience work on them as well is just asking them to stretch themselves even further. So it's a challenge, but we're willing to face it.
Awesome. Two related questions for Alex that have come from the crowd. One is about building, and the other is about healthcare in specific. So, the city of Boise is rapidly growing and expanding all throughout the Treasure Valley, Boise Meridian, and Nampa. With all this growth, we're seeing some beautiful mature trees come down. Is the city of Boise doing anything to try to mitigate the number of mature trees that are coming down when builders are building? There was an example cited of some construction going on State Street and a few beautiful mature trees that were taken down for that construction. Do you want to maybe answer that? Then I'll follow it up with part two.
Yes, Boise just came out with a new modern zoning code, and there are definitely provisions in there around tree preservation and requirements for tree planting for new developments. In terms of mature trees coming down, most of the times developers will have to pay a fee, and that fee goes into a preservation fund that our community forestry department will use to plant new trees and develop other types of projects to support our urban forest. And then those developers will face increased requirements when it comes to how many trees or the types of trees that they need to have on new developments.
That's great. And sort of the St. Luke's spin on this, we had to take down some trees for the Downtown Community Improvement Project. We worked with the Treasure Valley Canopy Network and some local companies to preserve the trees that we could. The ones that had to come down, we worked with the local company to try to turn them into furniture or other designs, trying to use the wood as opposed to just chipping it. And whenever the trees were healthy, we took them down and collected them and sent them to this local wood preservationist. And then we have also joined the Arbor Day Tree Campus Healthcare Challenge, so that we're trying to preserve and expand the tree campus at the Boise Hospital site, and hoping to expand this throughout the St. Luke's system, so that we're looking at how we can green our campuses, because we know it's good for patients and staff, temperatures, air quality, so many things. So if you want to learn more about that, our last month's talk was about trees and their impact on health, and you can find that on our YouTube site. The follow-up question to that sort of spins into this, Alex. Have you had any coordination with local healthcare organizations about this cool pavement concept? Healthcare systems tend to have a lot of blank pavement around them, and that seems like an opportunity that we could partner on.
We're just kind of starting to explore this. There was a pilot out at the airport. They did a cool pavement demo to see if it was something we wanted to explore. And I know that our planning and development services department is looking into this, and they've talked about doing an installation on 8th Street, but we would love to partner with local health and other organizations if they're interested in pursuing some sort of pilot. And I think it would be great to collect data and see what the impact is, collect community member stories of how they felt about it. I think sometimes the pavement seal looks different, and just that kind of social aspect can make an impact as well.
Geoff, I wanted to follow up with you about pavement and surface temperatures and some conversations we had before about burns. Could you talk a little bit about the increase and severity of burns you guys are seeing in Phoenix related to this extreme heat?
Yeah, this is actually an important but really sad topic. So obviously, when we have such high ambient heat, it really superheats our asphalt, our pavement. So when we have patients that are coming in for heat-related issues, heat stroke, frequently, I shouldn't say frequently, but there's frankly, a large number of patients that come in with contact burns from laying on the hot pavement. And this is everything from partial to even full thickness burns because of the hot asphalt. We're fortunate in that we're also the regional Arizona Burn Center as well. So we work with incredible surgeons, incredible resuscitationists that really help us with the burn management, as we're working with the true hyperthermia component of it. But we're, especially the pendant areas, buttocks, back of the shoulders, back of the legs, large volume surface areas can be affected. Same thing, there can be issues with the face, with the chest, hips, knees. So areas of contact, we're really seeing some increase in burns that are also needing to be cared for as well.
Yeah, you told me a story last summer when we talked about a patient that fell from their wheelchair while trying to get in the car.
Yeah.
and like within minutes had full thickness burns on the entire side of the body. That I mean, that was just so shocking to me to hear. But if you think about the urban heat island effect and how hot it feels in a downtown space, and then you're looking at blacktop asphalt, you can only imagine how hot those surfaces get. And it really takes no time at all for someone who can't get themselves up to develop a serious life-threatening burn.
Yeah, it truly can be within minutes. Yes, very much so.
Are there any changes in your protocol for pregnant women, Geoff?
That's an excellent question. No, there aren't. And I actually asked this. Pregnancy tests are part of our regular evaluation workup, but I don't know if we actually had a positive HCG in any of our evaluations. Obviously, taking care of mom is taking care of baby. So I don't think that it really would change outside of the fact that we would probably have, depending on gestational age, we'd probably have a much more close evaluation and management monitoring with our OB colleagues upstairs. But we do work very specifically and very intentionally with our trauma colleagues. We had to really develop our pathway to figure out, obviously ultramental status with elevated temperature can be from any number of conditions. So we had to talk to trauma and figure out what that was going to look like. How are our interactions going to go? Are we going to cool and continue to do a concomitant trauma survey? Are we going to prioritize getting imaging? We worked with the radiology department to figure out what would they let us bring into our CAT scan. Where essentially we have a water balloon with a person in it. And they weren't super excited about me bringing them this into our CT machine. But we ultimately figured out some sort of like best practices and protocols just internally, because it's really not done a lot. Same with our ICU staff, same with our medicine staff, talking about what our dispositions are going to be based on initial evaluation, because we're able to have people. And last year, I had two patients, very specific, or I guess different experiences. One of them was a young athlete that came in that was, very classically exerting themselves, had exercise-induced heat stroke. I put them in the body bag, and she woke up enough, and not woke up enough, but she ultimately told me, hey, I want to get out of this. I'm too cold. So we completely reversed. And it was kind of this weird question of like, well, yeah, we're going to bring you to the hospital, but even though you were tunded, we were considering intubating you, but we were able to reverse this fast enough. Do you need to go to the ICU? If your labs are looking okay, if you're looking okay, what does this look like? The second patient was someone that significant comorbid problems, atrial fibrillation with rapid ventricular response, plus hyperthermia, all these different things. Same kind of thing, he had multiple different medical problems, but as we cooled him, his mentation improved pretty dramatically for him to be able to give us more history and tell us what medications he was taking and figure out how we can really work on some next steps. And that's so helpful when we're thinking about, which level of care are they going to need most.
Geoff, I know you were talking about publishing these protocols. Are they at a point now where it's something we can share with our emergency departments and look at actively rolling out, doing some training with that video you've got? Again, we tried it last summer, and I think it would be great if we could get a little practice before we need it. So if you've got some resources to share with us, we could share them with our hospitals in the state of Idaho.
Absolutely. Yeah, we have, we can send sort of the written protocol and the sort of pre-publication information. Obviously, the idea is to share information to hopefully save people's lives. And that's the priority. So we're more than happy to share everything that we have with you guys.
Does Phoenix have a EMS protocol for cooling? Does the EMS crew do anything pre-hospital?
This is the first summer that we're going to be doing something a little bit drastic. So previously it's been cold fans, spraying. It's been very sort of it's been incredibly variable. This year, Phoenix Fire is doing cold water immersion as well. So we're working on partnering with them and providing some institutional knowledge and experience as they develop their own protocols. They're going to be doing ice water immersion pre-hospital starting this summer.
That's great. I think we have time for maybe one more question, and I wanted to take it to Alex. This is a question I love and would love to see. Is there any thought from the city of Boise about expanding that 8th Street corridor to more of downtown? I think Boise would really benefit from looking at some other cities across the globe that have done a great job of cooling by expanding their tree-lined streets, expanding pedestrian range and getting cars out of the downtown area. And I think my experience with the 8th Street corridor anecdotally has been that business owners love it and want to be a business owner on 8th Street. Patrons love it and want to, go to 8th Street to eat out and shop. So why wouldn't we want to expand this more? It's going to help keep Boise cooler, clean the air in downtown Boise, and also be better for business and quality of life.
Yeah, I don't know of any plans in the hopper to do that, but obviously we've seen how successful 8th Street was, and the fact that they're keeping it as a pedestrian-only corridor shows that it's something that the community wants. So I hope we look into that more too.
Okay, great. So a couple of big follow-ups for this talk. We've got that City Youth Climate Action Council heat event next Wednesday from, you said 5 to 7. And give us the details one more time, Alex.
Yeah, it's Wednesday, May 15th at the Whittier Community Center, which is attached to Whittier Elementary School, 5 to 7 p.m. And it's free. It'll be family friendly. And we'll have some snacks and prizes. And so we hope to see some of you there.
Great. And then we're going to take the summer off from the lecture series. So enjoy your summertime. And we'll come back in August. We'll make sure we send out notice well in advance. Thank you so much to our speakers, Geoff Comp from Valleywise Health and Alec Brooks from the City of Boise for an outstanding talk about heat.
Thank you so much. It was an absolute honor.
Thank you.